We want every physician to wake up, go into work, go to their clinic, and be excited because they're going to be doing what they went to medical school to do, which is to care for patients. And that any of the other things that have traditionally gotten their way or distracted their attention or used up their energy are just taken care of. And Elation is their partner in taking care of those things.
The mission of Elation hasn't wavered. We're still fiercely focused on primary care, fiercely believe that it's the biggest lever in the healthcare system and that it's underserved. None of that's changed.
To us, AI is just a how. Like the problems that we were trying to solve, the burden we're trying to remove, the delight we're trying to introduce, like that has not changed.
So tell me, do you think we're at a crossroads with what's possible in health IT today?
It's unquestionably going to produce incredible value that is going to help patient care. And I think instead of a crossroads, it's a question of, how do folks who are building technology, who are harnessing these capabilities, how do they take those and make them as useful and as valuable as possible? And it's not simple work. Clinical first is the sort of foundational product philosophy for Elation. So what it means is putting patient care first. And at the very heart of that too is this notion of the sanctity of the patient-physician relationship.
Yeah, I think a big part of what we're doing that's different from some other groups is that we're looking at AI as just one of many tools and one that strengthens our mission. It's not distracting us. It's not a thing that we're pivoting toward or doing for technology's sake. We're already in the business of removing administrative burden and making these workflows better for providers. We're really looking at all of the workflows we take for granted and going back to first principles. Does this thing even need to exist anymore?
The limitations of technology are things that clinicians have been forced to change their workflows around, change how they do work, change how they approach caring for patients. And that's just incredibly backwards. And going back to, what Phil was saying, like the opportunity here is to actually completely rethink assumptions and constraints that we've had in mind.
I frankly hope it's invisible. That's the dream, right? It's like nobody wants software. Nobody wants features. People want their information. They want to know the things that they need to know in order to care for the person across from them. They're not asking for laptops or keyboards or mice clicks. Like they just want to practice. So that ultimate dream is to make it go away. If you don't see it, if you don't think about it, then we're doing the best possible job.
If we go back to what makes a physician great, like great at what they do, especially a primary care physician, the heart of it is really around trust, the trust of the patient. You can be the most, you can have all the knowledge in the world and be the most brilliant at a diagnosis, but at the end of the day, if the patient doesn't trust you enough to tell you what's really happening, or if the patient doesn't trust you enough to follow through on what you asked them to do, or what the care plan you've laid out for them, then the patient doesn't get better. And so when I think about trust and I think about our role, Elation's role, and I think about words we want to be used to describe what we do, trust is a big one.
Yeah, and I think it's important to fight for primary care because primary care is healthcare. Like everything else is sick care. There's no healthcare without primary care. It's really tragic, the degree to which it's overlooked and underserved. And yeah, it's been super, super satisfying to work focused on that.
The goal, in fact, is to enable them to focus on caring for patients. That's the promise of Elation and what we're working every single day to do.